Minister, I raised the issue of the runaway bill for the new Children's Hospital and the impact that will have on other health projects. The original bill was for €650 million. According to the Taoiseach yesterday, the final project cost is now over €1.4 billion, €450 million higher than the figure approved by the government in 2017. It has been reported that the Minister for Health has warned Cabinet that it could cost up to €1.7 billion. Yet for this extra money there will not be one extra single bed. This massive overspend demonstrates a clear and grievous failure of competence that will have a dire consequence for the delivery of other necessary health projects throughout the country. Projects that may now be delayed significantly at a cost to patients' health care. It is patients ultimately who will lose out. For example, very real concerns have now been raised in and around the provision of the second cath lab in University Hospital Waterford and the National Forensic Mental Health Hospital in Portrane. So my 5 questions to you, Minister, are: why should we believe these new figures are any more than the previous figures? How will the extra costs be funded? How much will be taken out of the existing health capital budget? When will the Minister be setting out the projects that will now be delayed and the length of delay of each project? And when will the Minister confirm that neither the cath lab in Waterford nor our National Forensic Mental Health Hospital will be delayed?
I'm extremely concerned on behalf of my constituents and the people of the Mid West that the planned 96-bed inpatient block and the 60-bed interim accommodation solution, both promised for University Hospital Limerick, could in any way be put at risk or delayed because of the overrun in the capital project, the National Children's Hospital. Our hospital has been consistently at the top of the list of the number of patients on trolleys all of last year, and in fact it's the only hospital in the country that has had more than 10,000 people on trolleys in one single year, and it's at the top of the list again in 2019. This cannot be allowed to go on, and I want an absolute assurance that there will be no delay, no prevarication, no hold-up on the appointment of staff, because the current situation is intolerable for patients, for their families and for the people who work in the emergency department. And statistically, the Mid West has been underserved with beds, and we know that now from figures that are published publicly in comparison to other regions, and that's the basic reason why Limerick is consistently on the top of the list when it comes to trolley numbers. It has to be addressed and it has to be prioritised. So I want clear answers that progress on both projects will be maintained to deliver the beds that are so urgently required for the Mid West.
I don't know where Minister Harris is, or where is he hiding today. We were told that this would cost €1.433 billion, €450 million more than what was advised to the government in April of 17. I warned, and the Rural Independents had a motion here only a month before, a private member's motion before the decision was made to go ahead with this, of all this very thing. The parties now here that are talking, Labour and Fianna Fáil, all supported the Minister. Now, one of them supported, we warned of this very exact thing. The reply I got today received is staggering, and I'm concerned about South Tipperary General Hospital, as Deputy O'Sullivan serves the other part of Tipperary, where I am, and a 50-bed unit there. And every project in the country will be delayed. The staggering costs here are outrageous. $319 million of additional costs relates to construction costs, and the balance of $131 million, which is the overrun, which includes $50 million in VAT, relates to costs associated, wait for it, with staff, consultants, planning, design teams, fees, risk contingency and management equipment service. Appalling vista. We warned about this, and this won't stop at $2 billion, Minister. It's the wrong site. Connolly for Kids warned about it. We had a site in Connolly. There will never going to be a maternity hospital here on this unit is promised. There's no room for it. Nurses can't get in and out there. There's no parking space. It's not suitable. You can't make a silk purse of it a sow's ear, and this is an appalling vista under Minister Harris's watch and your government's watch, and the parties that supported you when they were warned about this. Now they cry crocodile tears.
And to the deputies for raising this issue. The new Children's Hospital project includes a state-of-the-art hospital being developed on a campus shared with St James's and the associated two outpatient and urgent care centres on the campuses shared with Connolly and Tella hospitals. The new hospital will become the single national tertiary quaternary centre for highly specialised paediatric care for children from all over Ireland, with a critical mass to deliver best outcomes. Together with its two paediatric outpatient and urgent care centres, it will provide all secondary or less specialised acute paediatric care for children from the Greater Dublin area. The health capital allocation in 2019 is €567 million for the construction and equipping of health facilities. Following the publication of the Health Service Executive's National Service Plan for 2019, The Health Service Executive is currently developing its capital plan for 2019. The HSE capital plan for 2019 will determine the projects that will progress in 2019, having regard to available capital funding, the number of large national capital projects currently underway, and the relevant priority of each project. In this context, you will be aware of the increased capital costs associated with the new Children's Hospital and the approval by Government of the investment to proceed with the building of the new hospital. In developing its capital plan for 2019, the HSE must consider the following: the amount contractually committed in 2019, the HSE's annual requirement in relation to meeting risks associated with clinical equipment, ambulances and healthcare infrastructure, the total capital exchequer funding required for the new Children's Hospital in 2019. The Government has agreed that the project will proceed in 2019 to completion in 2022. The impact on non-contracted capital commitments for the health services is that a selection of health capital projects and programmes will be delayed in order to contribute towards funding the increased capital costs for the new Children's Hospital project from within the existing health capital allocation. Health capital projects, including the development of additional beds at University Hospital Limerick, will be considered in the context of developing the HSE's capital plan for 2019. The additional costs associated with building the new Children's Hospital are of great concern to the Government. While the Government fully supports this project, it must have assurance that the construction project will be delivered within the current budget and timescale. The Government will work to minimise the effect of the increased costs of developing the hospital. However, we must remember that we are developing a world-class facility that will support the implementation of a new model of care for the children of Ireland. It will have a profound impact on all the paediatric services when open.
Thank you, Lascan Corley. Minister, I'm very dissatisfied with the reply. When this project was officially launched by the Minister Simon Harris in 2017, there was outrage at the time with the suggestion that this could be the most expensive hospital in Europe. Little did we realise that the Minister was far more ambitious than that, and now it looks like the hospital will be the most expensive hospital in the world ever. It is the Minister that has ministerial authority. It is the Minister that controls the Department of Health. It is the Minister that is responsible for addressing the capacity crisis in our health service, and it is the Minister that must accept his performance on the delivery of the Children's Hospital has not been good enough. We need accountability in healthcare provision, and the Minister needs to ensure that expenditure of the money that he is responsible for delivering delivers value for money. The Department of Health and the Minister has political responsibility and he has accountability, and so far his response demonstrates neither.
Lascan Corley, I find the response really alarming, particularly where the Minister said that a selection of health capital projects and programmes will be delayed in order to contribute towards funding the increased capital cost of the new Children's Hospital project. I've noted that you've said that it will be delivered within budget and timescale, but there were other commitments given. The Minister for Health came to Limerick and gave a commitment on timescale in relation to both the interim 60-bed unit and the 96-bed unit. Again, I repeat, the hospital with the biggest trolley numbers week after week after week in the country. These units are urgently needed. And if the Children's Hospital is going to be delivered within the timescale, well then the other commitments made by that Minister need to be delivered within the timescale as well. And I will certainly be pursuing this to ensure that we get the beds we need in Limerick, because people are on trolleys for hours and hours and hours, elderly people in pain, with no beds for them to go to. And this is entirely unacceptable. There is an expectation that these beds will be delivered on time, and they must be delivered on time.
With your response. It's as clear as the nose in our face that the money won't be there for projects like South Tipperary General or Limerick or many other projects. It's also extremely galling to have to now endure the belated and disingenuous bleating of all the other groupings and main political parties in the Dáil, when we in the Rural Independent Group, working with Connolly for Kids and Jack and Jill Foundation, clearly laid out the likelihood of this exact scenario coming to pass in our private members' motion of March 2017, a full month before the Government signed off on the original estimates. And not one member of your party, the parties, supported us. Not one. And they're all in bed together and left it off. And now we have the mess and the trauma of people sick and the waiting and trolleys and everything else. I have absolutely no confidence, zero confidence, that the National Paediatric Hospital Development Board or the Minister Harris are capable of ensuring that Phase B of this project will be delivered, or the National Maternity Hospital, which is meant to be there with it. And we know very sick children need to be rolled in from the maternity hospital, same campus. It won't happen. No helipad, only on the side of a building. No access by car because of chronic traffic. No room for safety for nurses, and no retention of nurses are able to get nurses to work here. It's an absolute fiasco that you're presiding over with the support of the political parties in this House, and now you can all cry wolf, but it's too late.
Maybe it's to be lamented that more of the rural independent group didn't accept ministerial responsibilities when they were offered to them at the formation of this government, because you have an answer for everything. You have an answer for it. Sometimes you can listen as well, Deputy
McGrath, there'll be no answer if you continue to interrupt. Deputies, please. Minister Flanagan is normally orderly and doesn't invite interruptions. Minister Daly, and you have a minute and a half now.
My apologies for being provocative.
Well, if you want less, you'll have a minute.
My apologies for being provocative, Concordia. While government fully supports this project, the additional costs associated with the project are of great concern, and we must have assurances that Phase B of the construction project will be delivered within budget and timescale. Accordingly, the Government has approved the commissioning of an independent review of the escalation in costs and the effective management of public funds. Arrangements for the commissioning of the independent review are underway. The Hospital Development Board will be required to provide ongoing assurances that Phase B of the project is being delivered within budget and timescale. Development is also well advanced on the 2 paediatric outpatients and urgent care centres at Conley and Tala hospitals. Works at Conley are on target for practical completion of the building in spring 2019, with the opening scheduled for July 2019. Works at Tala are underway with a target handover date of July 2020 and a main hospital to be completed in 2022. Integration of the 3 existing paediatric hospitals, the opening of the OPD and urgent care centres and the transfer of services to the new hospital facilities represent a highly complex project in its own right. The recent establishment of the Children's Health Ireland under the Children's Health Act 2018 to run the Children's Hospital supports the major programme of work of service and clinical integration required to run integrated services on the existing Children's Hospital sites, and commissioning required to achieve a successful transition to the new facilities when they open.